Series 5, organized by RX Doctors, organizing partner SCA Premier Clinical Research Institute, powered by EWTI, OECC, Radiant Health Center Canada, educational partner Jayamukhi College of Pharmacy. This conference fosters intellectual exchange and collaboration among experts, expose new innovative solutions to the global challenge. To start with today's session, we have Dr. Devi Priya Rajshekhar, BNYS, CGO, Naturopathy and Yoga Consultant. Founder of Namul Prabandham, it is a virtual platform to promote women's health. Founder and Managing Director of Avalin Ujangam, Secretary of Amma Trust and Lucky Man Group of Companies, Director of EcoWell Therapeutic Institute. She also conducted 50 plus yoga session, 500 plus yoga session both online and offline, attended 50 plus medical camps in government school, public gathering, college, etc. 50 plus webinars she has conducted, 25 plus health talk programs ma'am has conducted throughout her journey. Healing takes courage, and we all have courage, even if we have to dig a little for to find out it. And today we have ma'am who will be delivering topic on advanced practice through integrating healing. I welcome you, ma'am. The virtual stage is yours.
Hello, hi everyone, and thank you so much, Srinidhi, for introducing myself. And can we get into the session?
Okay, ma'am.
Yeah, sure. Hello, hi everyone, and vanakkam. So I think there is no self-introduction. There is no need of self-introduction because Srinidhi was given she was explained everything about me, and thank you so much. So we'll directly enter into the session. So today's session is like, no, first let me tell you what we are going to see and what are the things we are going to discuss today. So if a patient is diagnosed with any other diseases, whatever maybe of acute or it may be of chronic, whatever the disease, if a patient is diagnosed with the disease, so the first line of for the first line of treatment which come to our mind is like prescribing a drug or prescribing a medicine. So today's session is something is like about treatment modalities. The treatment modalities which includes what are the in and around things like water, mud. So what are the availability in and around and how we can use those things to treat a disease. So it's like a holistic approach. It may be of like alternative medicine, mixing up of all alternative medicines. So it will be like all together like a holistic medicinal approach. Okay, so we'll just start the session. And before starting the session, so if my voice was which audible in between, or wait, either my video has been passed or the PPT has been passed, whatever the issues, you can just pass me, and you can just let me know. If you have any other doubts in between, you can you're very open to ask in between. So we'll just go with that. Yes, you can go with the next slide. So first we'll go with the hydrotherapy. So hydrotherapy means the word even describe water therapy. So water is the thing. It's a very easiest, and it's available all over the place wherever we are, and that thing, and how we are going to use that as a therapeutical, how we are going to use water as a treatment modality. So the first basic thing of this holistic medicine is hydrotherapy. So first thing, water you can use, as I have told you that water we are going to use in the form of treating diseases. So the first mode of using water is drinking water, means intake of water. So we all know that wherever we go, and as a doctor or a normal layman, we know that we need to drink a sufficient water in, we have to take a sufficient water intake, and at least 2.5 to 3 liters a day. And we know our bodies, 1/4 of the body is made up of fluid. So our intake of water, that has to to be eliminated, and this proportion has to be maintained. So we know it helps to reduce the body temperature, etc. So and so, etc. So are the benefits. So first mode of treatment with water is drinking enough water. And second mode, actually in hydrotherapy, we have around 100 to 150 methods of using water as a treatment. So second example, very simple example, you people might have taken that treatment, or you people have been given this treatment to some person. So second is like hot fermentation. So hot fermentation is nothing but hot water pack. So there are so many hydro treatments like hot water pack or hot fermentation, and heat bath like heat bath, sitz bath, hot fermentation, almond food bath, food immersion. So these are the modes of treatment where we use water as a base. So let me tell you how water is, excuse me, be back just a minute. I'm sorry guys. I'm so sorry. Okay. We are back. So these what I have told. No, these are the water or hydrotherapies, and where we use water as a basic treatment, basic thing for the treatment. So let me tell you how water is used in the therapeutic modes. And no, we know everyone are drinking water. So some there will be a undoubted thing that will be running in the mind, that we drink water, we use water every day, but we suffer from disease, and people who have already deceased will also use water. And the way we use, and the main thing, the temperature we use is very important for treating a disease. So can I have the next slide? Yeah, next one. Third one, we'll just come again to the second. Yes. So the main thing, temperature of the water is very important in treatment side. So the picture which one I have attached here is like temperature. Based on that, we are going to use the water for treatment. So we usually know water, either it will be cool, it will be hot, neither it will be warm. So here the temperature of water, and this particular temperature of water we are going to use in the form of treatment. Okay, so how the water will affect in our body. So you people have been you will be learning also, if we are taking medicine. So what will the mechanisms, starting from mouth, how it absorbs it to the bloodstream, and how it works, and last how it eliminates. So this is the effect what the drug or what the medicine will create inside the body. So how the water affects in the body is only two reactions, or only the two mechanism of water will be happen in our body. So we have to divide the phase of treatment into two. First is action, second is reaction. So action is like, so if I have a sudden nose bleeding, so I was a sports player. So for example, if I was a sports player and I got a sudden nose injury, we'll apply ice over our nose. Okay, so in order to stop the bleeding. So application of something, either it may be hot, either it may be cold. The application phase is called action phase. So if I have swelling here, I apply ice. What happens? That is action. After removing ice, I have some phase of reaction will be happening inside my hand. That will be reaction phase. So if you apply cold, if I was applying directly cold, if I was directly applying the ice on my nose, blood vessels constrict and the bleeding will be stopped. So once a phase of action is stopped, we'll remove the ice. That is reaction, and again the vasodilatation happens. So this is the effect of water. If we use the water either intake or either be like, what are the modes of treatment I have told, like ice application or hot fermentation bag, means hot water bag, hot immersion. So these are the treatments. So based on this effect, this was the basic effect that happens to our body. So either you people know whether you have any idea about where to give hot and where to give any hold. If you have any idea, you can give thumbs up, or no means you can just, if you have any idea about, yes, yeah. So giving hot vary, and the place where we give hot is vary than when the place where we give cold. Okay, thank you. So if a bleeding occurs, so let me tell you which are the place we have to give, where are the place where we have to give cold and where we have to give hot. So before that, let me tell you where we use this hydrotherapy in the treatment modalities. Can I have the second slide? Can I have the second slide? Yeah. So here are the places where we'll mostly use this water or hydrotherapy. This is the major part. First is pain relief. So people with periods cramp, this is very common. No, in every home, if a girl or in a girl's hostel, they'll have hot fermentation bag with them in order to compensate their periods cramp. So main part where we use hydrotherapy is pain relief. So if we have any acute pain or chronic pain, so these are the treatment modalities you yourself can prescribe your patient, or you yourself can give your you yourself can advise your family members before using any drugs or before using any medicines. These treatments, it is not going to give you any adverse effect, and it is not going to give you any sudden immediate effects, but it gives a like soothing, and it gives you a calm effect. Okay, so these are the place where we use hydrotherapy. First is pain relief, and second is like joint mobility. So I'll just go with some of the example what we have to do. So first is pain relief. In case of pain, so if you have any acute pain like sports injury, so if I have any sudden hit on my leg or hand, if I have a sudden sprain, or if any pain which is acute, we can go with cold. If a pain with chronic, like arthritis, joint pain, back pain, disc bulge, so in those cases you can go with hot mode of treatment. So next is like for improving joint mobility. So as I have told you, in case of arthritis, so along with hydrotherapy, so you can use some other modes of treatments like herbs. You can mix with water, you can make like a paste and you can apply. So that will also help you for this chronic cases like mud. So mud, in the sense, it's a normal clay or normal sand which is available over your locality. Gardening in those areas, you can just take the sand, filter it, dry it in sun. You can mix it in water. Same, if it was cold, you can mix it with ice cubes. If it was in case of hot treatment, you can just mix it in water, boil it, heat it, and that hot mud can be applied over a particular part, which is the area you want to apply. You can go with that. And for muscle relaxation, so for muscle relaxation, let me give you another example is hot foot immersion. Means nothing but you can fill hot water in your bucket and you can keep both your legs, either legs or hand on that hot water, to just for muscle relaxation. And this thing I'll just tell you in acupuncture side. So already we have all, this is nerve endings and blood vessels ending. So if we are giving hot foot immersion or hot hand immersion, so that will helps on the particular area, related area, internal organ, and that helps in vasodilatation also. So pain relief and obviously like muscle relaxation, it helps. So these are the part where we use hydrotherapy or water as a therapeutic basis. So you people can, you can have a doubt that whether this hydrotherapy is used only to treat acute diseases or only to treat any small kind of things, or like periods cramp, it's like bleeding, or only like pain. So it is not about only acute cases. You can treat these chronic cases with hydrotherapy. So the treatment modality will be little different. So like those treatments are like bath in the sense a particular tub or particular area, we have to immerse our full body in that water, like hip bath, sits bath, spinal bath, and they'll spray the water to the particular direct affected area. So as I have told you, there are around 100 to 150 types of treatments involved in hydrotherapy to treat the diseases. Okay, so this is a very small and a very short introduction what I have told you about hydrotherapy, and we'll just discuss one by one, and all topics you'll just get some idea. Main thing is the topics what we are going to discuss one by one next will be something new for you people, and very sure you will have something like at least you will have something you'll have excited thing to learn in upcoming slides, because it is completely devoid of medicine. So in this thing we never use any external herbs, or we never use any external formulas to intake. All the treatments what we are going to see is like something we are going to give externally, not internal. Okay, so we'll just go with the next slide, next topic. If you have any other doubts with hydrotherapy, you can just put all your questions in chat box. If no, you can give thumbs up. Or if you want me to clear, if you want me to explain little more clearly, we'll continue. Okay, thank you. So can we go with acupuncture? Yes, acupuncture and pressure. So what are the things now? Sometimes something will be like you'll never understand, or you'll never get a clear picture, because what I give you is like overall approach or overall summary of particular topic. So if you want to have a clear explanation, or if you want to have a clear detail, you can just ping me directly. Okay, so for the second thing is acupuncture or acupressure. So is anyone have experienced this? Yeah, ma'am, I have taken acupuncture, or my mom or my sister or my someone in my family have taken acupuncture. No, I haven't taken, but I have heard the name. Anything like that? Anything like that? Yes. Trinity have raised. Yes. Okay. So you people have taken acupuncture. Ma'am, can I? What are you? Oh, I had 3 more questions in chat box. So let me clarify this thing. So give me some time. I'll clarify this. We'll finish this acupuncture and I'll clarify all the doubts in the chat box. Okay, I have some questions there. Okay, so acupuncture and pressure, it's like the word is acu is a needle, puncture is like putting inside something, piercing, puncturing. So that is defined as acupuncture, putting needle. Okay. So this is actually a traditional Chinese medicine. So it have a huge historical story, how it came from China and how people have started following here. So the picture what I have given in this is the basic principle of acupuncture. Okay, so in yoga we say it is like vital energy, and what we say in normal term is like breathing. What we inhale, what we exhale, that's like vital force, the force which keep us alive. So that force, that energy, in China they'll call it Q force or Chi energy, Q energy or Chi energy. So this is the basic principle of them to start this acupuncture treatment. So no, in one word, there will be around 350 to 400 points. So the points what I was telling is like, it's just important points. Now I'll just show you. I just want to show you all those things. I'll just show you the pictures because I can't tell you, I can't tell all the 400 points now. I'll just show you the picture alone. Can you able to see this man and all the dot? Yeah, so these are the points. These are the points. So like this, we'll be having, I think you can able to see this man back. So these are the points. We'll be having around 50 to 60 points in years, only in years. So around, yes, I have told you, around 350 to 400, 350 to 400 points will be all over the body. So the basic principle is that they have 12 meridians, means like 12 major, it's not like, 12 major organs that are connected to all other bodies. So this 12 meridians is like, meridian is like pathway. So one pathway, there will be around 50 to 60 points. Average, I was telling in average. So 50 to 60 points will be there. So some meridian will start from face to hand, and the next meridian will start from front side of your hand to chest, and next meridian will start from chest to down. So this meridian is like, this is the energy pathway. So as I have told you, it is a traditional Chinese medicine. So these things are like pseudoscience. So no, this meridian will carry. So if I was pricking one point, this will carry the energy, and by that the internal diseases will be clear. So this is the traditional Chinese theory. And what is the theory behind this acupuncture is like, we are stimulating the nerve in endings, and by that nerve ending it works. Okay, so I'll just tell you some of the common points what you people can use in your day-to-day life. I'll just give all the introduction, and I'll tell you the thing. Okay, I can go with the next slide. I'm so sorry because I was interrupting in between. No, my voice will be breaking, and I'm so sorry, I was getting called. Yeah, so what are the effects of acupuncture? So this is the 6 basic effect what we have, what the acupuncture will give. Okay, first is analgesic, second is sedative, third is and anti-inflammatory, motor effects, and psychological effects. Okay, so first for pain relief or just like numbness, just to make the particular part numb, or just to make just analgesic effect, you people have you can just understand by the name. Okay, so pain relief and sedation. So this is the main two things we'll use acupuncture more. No, this is the two part. This is the most common effect for which we prefer acupuncture. One is pain relief, and for second is for sedation. Okay, so these are the effects, or these are the plays. So first, let me tell you some of the common acupuncture points that you can use in your day-to-day life. Okay, so the first point is like, you can place all your fingers together. This is the area where the anatomical snuff box, no, that is the part is called as L4. And no, forgive me, I have very poor number memory, and this, as I have told you, no, we have 350 to 400 acupuncture points, and those points are named with numbers. So if it was lung meridian, L1, L2, L3, L4, and if it was like heart meridian, H1, H2, H3. So no, I have very poor number memory. I know points, but I don't know its name. So here is a point where I have given. So this is a very common point, common analgesic point. So if either anyone have a severe frontal headache, if the headache is because of migraine, or if the headache is because of stress, or if the headache is because of dehydration, so and those part on those time, you can give pressure over here. So this pressure point is very good for, excuse me. Okay, so this pressure point is very good for headache. Okay, so you can just mark it down, this one. And the second most common point is here. No, and the second thing is for measuring the point, they'll be using fingers, and this two finger they'll be calling us one chun. This was a Chinese name: one chun, two chun, three chun, four chun. So they'll be keeping finger for measurement. Excuse me, someone is about to tell something. Excuse me. Okay, set. From your wrist line, you can go one tune down. So this is the point. If you have any travel sickness, or if you have any vomiting sensation, sudden vomiting sensation, so you can give pressure over this part, and this is named as P6, pericardium 6. Pericardium is also one of the meridian, so you can give pressure here. So acupuncture is like, you can see the immediate effect. So acupuncture, or either puncture or pressure, both the thing will give you immediate response, and you will feel the immediate result. And here the line on your wrist, elbow joint, medial side. So this is a point to enhance your immunity. So the second thing is like, if you have this, these are the points based on the meridian. And the second part, which is very useful for the even layman, or which will be very useful for people like us. No, I don't remember points. I can include myself with you also. For us, the basic points is like local points, or we'll call it as OS points. This is like nothing but, if I have pain, if I have pain somewhere, so if I have pain on this part, maybe like my medial region of my forearm, so the point, the place where I have pain is OS point or local point. So you can give directly pressure, either pressure or needle on that particular point will helps in pain relief. So local point is always preferable for pain relief. Okay, so the next is hand. This is all about acupuncture and pressure. So on the side of acupuncture, you can go with next slide. On side of acupuncture and pressure, for stimulating, that was the needle. The first picture, white background. So that was the needle, acupuncture needle. So this is a common needle what we use. There are so many types of needle. This is a common needle what we use. We'll have a head and a body and a firm tip. Okay. The tip will be very small, and we'll be pricking inside the body, and the needle goes inside. Mostly the patient will never feel any pain. Sometimes some part they may feel pain, because if it was directly to the muscle, if it was directly near one bony area, they'll feel pain. Sometimes they'll feel pain. So this is the most common needle we use. Sometimes we'll use round shaped needle on ears. So this is very hard to give on ears. Acupuncture, particularly we have auricular therapy only on ears and scalp acupuncture only on head. So scalp acupuncture, that gives very good result in case all central nervous system diseases like post-stroke effect, cerebral ataxia, the people who are related with severe chronic cases related with CNS, you can go with scalp acupuncture. In session of 7 or 15, based on the condition, they'll get started improving. Okay, so the down a pipe, which is a paper rolled burnt paper that was there on second picture, that is called moxibustion. So once the needle is given, something has to be given for stimulation. So if it was stimulated, the effect will be little faster. So for that they have used this. This is also based on China's treatment, moxibustion. So they'll have the plant name called moxa. So that plant have been rolled, so they'll keep on the needle just to get the effect little more faster. And nowadays we use electrical stimulator to stimulate the needle. So if we have connected the electrical stimulator, the needle will be keep on moving, so that stimulation will enhance the result faster. Okay, so this is all about acupuncture and pressure. So next we'll go with hand and foot reflexology. So hand, this is the picture I have given. Hand, be there. I want that picture. Hand and foot reflexology. Yeah, this is the part. This is the areas. The thing is, all our internal organs has been represented in our hands and on soles. So the particular area where we give pressure, that will be related to the internal organ, and thereby we get a effect. Okay, so by giving hand massages on that particular area, so for example, this thumb is related with your head, so giving pressure here for insomnia patients, so you will get some improvement in your sleep. And these are the areas where I have mentioned, hands and foot. So this particular area, you are supposed to give pressure on that area, so that by that it will helps to clear your problem inside. Okay, so the thing is, I know this topics will be completely new for you people, but still, I was giving all just introduction moxa. No, I was not telling this is a disease and this is a point and this is the thing you have to do. Or I was not telling anything more peculiar, and I was giving a overall view. I know it will be very hard to understand, but at least you will get something out of this. Okay, some 1 or 2 points out of this short summary. So yeah, next I'll tell you the common points. These are the points for headache, where I kept bindi, center of eyebrows. This is one, and center of your eyebrow line, and last corner of your eyebrow line. These are the points you can use for headache. You have to give nice pressure either clockwise or anti-clockwise. And this is a point below your nose in above your upper lip, and this is the area to give the people who have who was about to faint, or if they feel giddiness, you can give pressure on this area. And those who feel like sleep disturbance and they never get sleep immediately, you can give pressure at the back of your ears. You will have a depression here, so you can give pressure on the back of your ears. So these are the very common points you can use. And the second and the last point for your periods cramp is, you can bend your leg for 3 chun, means your forefinger above your medial malleolus on your leg. Forefinger above your medial malleolus, that is the point you can give pressure. That is spleen 6 point. So you can give pressure for irregular periods and severe periods cramp. Okay, so all the further details, pin me, I'll give you all the points what to do and how to give acupuncture. Okay, so we'll go with the next slide, next topic. Whether you people got anything you have cleared with acupuncture, can I go with the next? Okay, so I think we'll just have a look. We'll just have a look in the chat box. Let me clarify all the questions there. Yeah. Hamita, ma'am, can I ask one doubt? Of course, yes, you can. When small injuries, which water use, either cold or hot at this place? Small injury means I didn't get your question, so I'll just explain you. Small injury, it may be like if it was cut injury, or if it is like sprain, sprain or strain. I don't know what is small injury. Can you just define that small injury? If it was like acute, you can go with cold. And the thing is, the reaction I have told you already. No, what is the effect I have told you? If you are keeping, if you want your blood vessels to constrict, if you want something to constrict, if you want something to no stop, arrest your bleed immediately, you can go with cold. The result, if you want your no, if you want to arrest your bleeding, you can go with cold, but you should not take it immediately. The action phase should be prolonged. You have to give more duration. That is very important. You have to apply ice for some period of time. Only then you can, once the bleeding is completely arrested, you can remove the cold. Okay. So what kind of effect you need? That effect, if it was either you get in action phase, either you get in reaction phase, but that phase, that particular phase should be prolonged. How can water use in rehabilitation? It's like hot foot immersion, as I have told you. Hot foot immersion, heat bath, sitz bath, all the water treatments will be helpful in rehabilitation. I have heard acupuncture in Chinese medicine. Okay, I have here name acupuncture. Ma'am, is acupuncture useful mode of treatment for paresthesia symptoms, burning, or pin and needle sensation in hand and foot in vitamin B12 deficiency? No, if it was because of vitamin B12 deficiency, vitamin B12 deficiency has to be corrected, but it helps. Acupuncture helps in burning sensations or pin and needle sensation. Of course, acupuncture helps. But if it, because sometimes it may be because of diabetic neuropathy, diabetes. So in that cases, you can reduce the diabetes, and along with that, you can give acupuncture. But without reducing the sugar, if you are giving acupuncture, it never works. If it is because of vitamin B12, without compensating or without correcting the deficiency, acupuncture will never help. The root cause of the problem is vitamin B12 deficiency. Always, whatever the disease or whatever the problem, root cause should be addressed. So that should be addressed. So once the root cause is addressed, only then we can easily sort out the problem. So what all other treatment what we are giving is just no symptomatic relief. Okay. So cleared. Can we go with next topic?
Yes, ma'am.
Yeah. Okay. 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 Have anyone or any of you people have experienced massage? I was getting heart. Giving you heart back again. Okay. Oh, okay. Further. Okay. Have anyone have experienced massage? Any experience? Massage? Either you have given anyone or whether you have taken? No. No one? Okay. So, I'm getting one or two replies. Okay. So what is therapeutic massages? So no, massage is like, no, it's a very common term. And what are the treatment modalities we are, no, I was discussing now. What I was telling now is like, it's are like trending, and these things are like a new brand nowadays. So massage is one of that. It was very, no, the thing which was when I was worked in Bangalore. One month before, still I was working in Bangalore through online. No, I was working in Bangalore, but no, a street we'll have at least 2 to 3 massage centers. So massage is like, no, as I have told you, it is blooming to trend. So therapeutic massage. So massage is like we have different protocol on naturopathic massage, and something will be different on Ayurvedic aspect. So massage will be in where the place massage will be very useful, or where the place massage will be, it is very popular is, one thing is like weight reduction, and second thing is like relaxation, like rejuvenation, and third thing is like musculoskeletal problems. Okay, so these three parts where massage is playing a major role. So what will be the effect of massage? Effect of massage is nothing but something we are taking something. So if you are rubbing your skin, you can just go with the try, fold your hands, started rubbing your hands with your palm at least for 1 minute continuously. Either you will feel heat for at least 30 to 45 seconds. After 30 to 45 seconds, and after that you will feel redness. Yes, you're accepting what I'm saying. You will feel heat. You will feel heat, and you will have that redness. These are the effects. So the same effect you will have in massage. We are taking oil, we are rubbing on the skin, so heat is generated. Main thing is like they are enhancing the blood circulation, and we are relaxing the tightened muscle, we are toning the muscle. So we are enhancing the muscle elasticity. That's it. This is the effect of massage. And the varieties of massage, there are so much of varieties. We shoot Swedish massage, Thai massage, and ordinary naturopathic massages, Ayurvedic massages with Ayurvedic herbal oil. So let me tell you what are the simple massage technique you can use in your home. Okay, so if you people are ready, you can turn on your cameras. If you people are ready, you can turn on your cameras. We'll just go with simple head massage. I'll teach you how to do simple head massages. Head massage, either you can go for yourself or you can do for your family. So you can go with mild stroking. So mild, this is called stroking. I'll remove my watch. Mild stroking is like moving fingers on the part where we are giving massage with mild pressure. Pressure should not be more, mild pressure. This is stroking. If this is with pressure, it is called friction. So if this is the term what I'm using: stroking, friction, tapping, clapping. These are massage terms, technical terms. Okay, so you can go with mild stroking and then circular movement of your scalp, and you can rotate your hair, and you can pull it out, rotate your hair, pull it out, rotate your hair, pull it out. Again stroking. Again you can go for tapping. You can go with tap from starting to ending. Tapping, clapping, beating, again stroking. So these are the methods you can go for scalp. And same method you can go for legs also. Legs, hands, wherever. And the thing is, if people who have high in massage, there is two important thing we have to note it. One thing, the oil we use. The oil we use for massage. And second thing is the method, means the direction we use for massage. There is two direction. One is towards heart, second is away from heart. Okay, so for example, I'll just what I can tell, I'll just take varicose vein. Okay, so if a patient with varicose vein, what kind of oil or what kind of massage should I need to give? Okay, so first thing is oil. On my personal experience, if I get a person with varicose vein, I'll go with olive oil. So olive oil, that will enhance that blood circulation will be good with olive oil. And particularly if varicose vein, if you want, you can note this ratio also. If you want to go with the try with your family members, you can just note this ratio. If a patient with varicose vein, you can go with 2 cups of olive oil, 2 teacups of olive oil. In that 12 to 20 garlic cloves of garlic, grind it, mix it in the olive oil, and you can go with 1 full lemon juice. Mix it, keep it overnight 24 hours, and the next day you can go for massage. So first thing, whatever the problem, main thing, the choice, the thing, what oil you are choosing, that is important. And second, already the patient have varicose vein, so the blood flow direction, that should be towards heart, not away from heart. So the massage, if this was leg, your massage direction should be down to up. You have to give massage from down to up. Okay, so this two aspect is very important while giving massage as a therapeutic basis. Okay, we can go with the next slide. We can go with next slide. Yeah, so as I have told you, these are the types of massages. And for sports massage, it will be little hard. The massage techniques will be little hard. They'll be pinching the muscle up and down, and they'll be using some vibrators, and they'll use some herbal powders like trifala powder and all those powders for massage, in order to keep their muscle strength and muscle build up. So sports massage will be little harder, and all other types of massages will be like little more soothing, as I have told. These are the techniques, and it will be differ. That's it. The timing, and if in Sudis massage, if they are giving tapping for four times, in Thai massage they'll be giving for 5 to 6 times. These will be the mild difference between the types. So as I have told you, these are the benefits: physical benefit and mental benefit. So mainly it involves cardiovascular system and musculoskeletal system. Sometimes mental health, it helps. For mental health also it helps. Okay, we can go with next slide. So main thing, based on massages, this is the two thing. One is the oil what we choose, and second is direction of massage. So oil, first for varicose vein, I have told you olive oil along with garlic and lemon. This was my personal experience. So if you want to go with a try, you can go with a try. And all other oil is like, you can use coconut oil, you can use castor oil for like periods cramp or your reproductive issues, to reduce your body temperature. You can go with castor oil. Just mild massage, general rejuvenation, you can go with coconut oil, in order to increase the lubrications. Arthritis patient, frozen shoulder, if you want to increase the joint lubrication, you can go with either castor oil or sesame oil. Mustard oil is for pain. If you want, you can note it down. Mustard oil, you can go for pain, and all other neurological cases like insomnia, or not. Insomnia is not a neurological case, but all other neurological cases like cerebral ataxia or incoordination, or kids like autistic kid, ADHD. For those people, you can go with Bala Taila. I don't know, what they'll be telling in full Sanskrit term, I forgot, but Bala Taila. Ashwagandha. So those things, they'll be having extracted oil. That oil you can just apply over their head. Okay. Mahanarayana Taila. Those things you can go for pain. Okay. So next is aromatic massage. This aromatic massage now, as I have told you, massage is a common trending thing nowadays. So this aromatic massages, those things they have been using in spa, beauty parlors, are those areas. This aromatic massage is common, and here they use fragrant, that something which gives you more aromatic nature oils are used in this massage. Mostly massage techniques are same, but here there is not be hard tapping. These things will not be there. It will be like mild soothing type of movements will be there, and all the effects are same. Okay, and the thing is, massage steam bath after massage will enhance the effect of massage twice. So if you want to go with a try, or if you're going for a massage, you can take massage, and immediately after massage, you can go for full body steam bath. So your effect, you'll get the effect twice. Your result will be double. Okay. So I think massage is done. So you people have got some idea. Any questions? Any clarifications? Cleared with hydrotherapy, acupuncture, and massage. Any doubts?
I mean, which condition we need to do massage, like towards and away from the heart?
I didn't get you. Can I come again, please? Which condition?
Like we need to massage like towards and away from the heart. In varicose, explained right?
Yeah. Oh, you need you want me to tell all the things, right? For which towards heart, for which thing away from heart, right?
Yes, ma'am.
Yeah. Yeah. Okay. Okay. So main thing first I have told you is varicose vein, and then people with hypertension can go with if you are doing for limbs or if you are doing for legs. Usually people with hypertension, either pregnant people who have pregnancy, PIH mothers, and normal hypertensive people, you can go with down to up. Okay, down to up massage movement. Either not they are not PAH and the swelling is not because of hypertension, it's just mild swelling, you can go with up to down. No plain swelling, nothing any, no, they don't have any other associated diseases, just swelling, you can go with up to down, means this movement. And if it was because of hypertension, down to up. And the thing is, if whatever the disease, no, I didn't suddenly I didn't get any other complaints. No, if you are ready to put the disease, this is a disease and what type of movements we have to give. And if you are putting any disease in the chat box, I'll just tell you.
In case of
Hypertension.
lung disease.
In case of lung disease, mainly actually the question is good. I was about to tell another one thing. In case of lung disease, the massage we are giving is, we should not give directly on the chest. You have to give at the back of your chest. Okay. So whatever in case of lung diseases like wheezing, whatever maybe, whatever the respiratory related issues, we have to give massage on the upper back, and the movement should be center to out. You have center spine, center to out, not out to towards your center to out. You can give, and not directly on the chest. You can give at the back of your chest, but you can go with breast massage if the particular feeding, if the particular mom is under feeding and the milk secretion is not sufficient, the milk secretion is not that much enough to meet out the baby, so you can go with breast massage. That will help in case of milk secretion, that will increase the milk secretion. In that case, you can go with plain breast massage, circular and anti-circular movement, and you can make a fist and move that. But apart from breast massage, there is no direct massage over your chest. You can give at the back of your chest. And if you are going to give massage, after massage, as I have told you, after massage, if you are taking steam bath, will be double your effect. As same as after massage to your chest, you can go with heart fermentation over your upper back. That will enhance your muscle result, massage result, and that will indirectly affect your respiratory problem also. Okay, as same in chest, after chest massage, you can go with heart fermentation, and the temperature should not be more because tissues over your breast were very soft. So you can go with mild heart fermentation. This will help for blood, milk secretion also. Okay, I think your doubt have been cleared. Yes. Okay, thank you. Okay, can we go over the next topic? Yeah, okay. So the next is lifestyle disorders, and how we are going to correct it. Okay, so the lifestyle disorders, no, I have mentioned only three to four pictures. So main disorders which are very common, what I was seeing very common nowadays, so I have mentioned here. So these are the disease, like these are the disorders which are termed as lifestyle disorder, because the root cause of the problem is change in their lifestyle. So as obesity, diabetes, no, 30, even 25, 30 plus people are affected with diabetes because of their lifestyle, and of course PCOD, and back pain and knee pain. So obesity is like, no, back pain and knee pain, that may because of their sedentary lifestyle and the way they sit. Now people with IT profession, they have to sit for a long time, and there is no chance of going out, there is no chance of active physical exercises, and those people are very common with knee pain and back pain. So I have mentioned those things. So these are the lifestyle disorders, and how to overcome this, what are the lifestyle changes we can do by no we can do to overcome from this, we can do to prevent this. Okay, so we'll go with the lifestyle changes. Next slide. Yeah, so the first important thing here is diet. Okay, so diet, whatever the problem may be, so it may be obesity, or it may be of PCOD, or it may be of diabetes, whatever the lifestyle disorder, the single dietary principle what I will have in my mind when I was sitting to start doing, no, when I was sitting to work on diet charts, first low carb. Sometimes if it best, we go with zero carb. So low carb, high moderate protein and moderate fat. Sometimes based on people, high fat, sometimes based on patient, high protein. Okay, so this is the one dietary principle that you can follow to prevent all the lifestyle disorders, or to treat all the lifestyle disorders. So if it was diabetic, if it was PCOD, if it was obesity, or whatever the pain may be, the no, the treatment protocol what we give is like no, medicine or drug. So what we are giving is like no, suppressive. It is not suppressive, it is like symptomatic relief. Okay, so this lifestyle changes is addressing the root cause. As I have told you, whatever the problem, just address the root cause, only then we can give the best result and we can reverse the problem. So first is diet. First and most important is diet. So if we are correcting their, if we are ready to correct the patient's diet pattern, no, the disease will be it will be coming half to the half to its limit. Okay, so first is diet. Main thing, whatever the disease, we have to reduce the carb intake should be less. And I'll just tell you some of the diet tips. Can I tell you now, or can we discuss the diet little later? Any one or two, you can just take, unmute your mic and let me know, or you can let me know in chat box, because it's already time. I have to finish all the topics. So if you are feeling bored, or if you want to, like, if you want to know any diet tips, yeah, is it okay to discuss now, or is it okay to discuss later? Getting one or two thumbs ups. Now, yeah, okay, now we'll go with that. Okay, so we'll just go with the common diseases. So first one, diabetes. So for diabetes, main thing, as I have told you, they have to reduce the carb. Okay, so they have to reduce the carb, and they can go with more protein and more fat. So along with that, I'll just tell you one or two peculiar diet tips that will reduce the sugar, patient's sugar content. One is bitter gourd juice in empty stomach. They can have bitter gourd juice in empty stomach. That will reduce the sugar. So I'll just tell you, you can just note it down a little faster. Bitter gourd juice, lady's finger soaked water, almond gum soaked water, ash gourd juice if they have acidity, or if they have hypertension, and if they have swelling because of hypertension. Ash gourd juice, cucumber juice, aloe vera juice. These things they can take in empty stomach. And if diabetic people, if they want to reduce the sugar, they can go with fenugreek soaked water or fenugreek mixed buttermilk along with food. Usually people will say, ma'am, I'm taking fenugreek in empty stomach, still my sugar is not coming down. Fenugreek, taking in empty stomach, fenugreek will never help. Fenugreek you have to take along with food to reduce your sugar. And then for PCOD, you can go with licorice powder. Boil the licorice powder. You can mix 1 spoon of licorice powder in 1 glass of water. Boil to half, and you can drink that once in a day. For PCOD, you can boil and take ashwagandha also. So these are the peculiar points that will give tremendous result very fast. And taking this and eating more carb, or taking this and eating more sweets will never help. Okay, main thing is base of your diet. Along with this, you can add these things. And for pain, reducing all your pain, you can add more pepper, more ginger, turmeric, garlic in your diet. And you have to avoid all processed food, main carbohydrate. And if people have acidity, either hypo, either hyper, or either gastric reflux or ulcers, they have to avoid tur dal, black gram, tur dal, black gram, wheat, sweets, wheat and wheat products, sweets, tea, coffee. So they have to avoid these things. If a particular patient is anemic, compulsory, they have to avoid tea. If a particular patient, they have insomnia, compulsory, they have to avoid coffee. Is this okay? So these are the very common case I was seeing. So if you want any other diet tips, if you want any other diet for any disease, you can just pin the disease in chat. This is the case I usually know. This was the common cases on my consultation. If you want any other disease, no, you can go. You can just put the disease in the chat box. I'll just tell you. Okay, I think it's done. I didn't get any. Okay. PPT. Okay.
Indra, ఏం తడిగుడ్డలో
Ma'am, is it visible, PPT?
No.
I shall check it with it, ma'am. 2 minutes.
Yeah, sure. Okay. So I think these are the disease. If you want, if anyone you want any other particular diet tips, we'll go with that.
యాడేస్తున్నారు దాని మీద
Okay. So let me think. Okay. Common. Next thing is based on season. If they have common cold,
Hello.
Is it visible now?
Can I? No, PPT is not shared actually. No problem. PPT is not shared. Can I continue? Can I share?
Yes, ma'am, you can.
Yeah. Let me share. Let me share. I'm going to share my screen. If you people know you want to ask me something, you can just unmute your audio. Yeah. Someone is sharing screen. I can see the screen. Yeah. Okay. Yes. Before slide. The slide before. The last one before this. Okay, so I think I have cleared, I have told you all the before slide, all the basic stuffs about diet. Yeah, thank you. And the second thing is physical activity. So main thing, whatever the physical activity, either exercises or walking or gym or swimming or dancing, aerobics, Zumba, whatever may be, but the physical activity that is very mandatory and that should be in our day-to-day lifestyle, either 1 to 45, either 1 hour to 45 minutes is very must. So you can advise this thing. And the third thing, more important thing, their sleep pattern should be corrected. And yoga you can include it in physical activity also. To enhance their sleep pattern, they can have milk in night before half an hour, and no screen time before 1 hour, and color therapy. You can include all the treatments. Milk, diet, no mobile, no blue screen before 1 hour, blue paint, blue color paint in the room or blue color curtains that will enhance the sleep pattern. They can have cold compress in their eye, means dip the normal cotton kerchief in the water, hold it, keep it in your eye. So that will also help to enhance your sleep pattern. Best hot food immersion, fill the hot water in the bucket, keep both your foot inside the bucket for 15 to 20 minutes. So that will also help for to increase the sleep. You can add Epsom salt. This hot food immersion with Epsom salt you can give in case of diabetic neuropathy, means pins and needles. Someone have asked, pins and needles or burning sensation in food. You can go with this hot food immersion with Epsom salt. So that should not be very hot. You can go with mild warm water mixed with Epsom salt. You can go with hot food immersion. And then all traditional and cultural practice is nothing but getting in early and praying or doing good for others. All those things are like lifestyle changes. Okay. Okay, done. We'll go with the next slide. Is that boring? Is that boring? Yes or no?
No, ma'am.
Okay. Thank you. Okay, next slide. No. Okay. Thank you. Okay, so the next thing is we are going to do clapping therapy. So I just want you people to little more active. So are you PPT again? It's gone. Okay, no problem. So next thing what we are going to see is, yes, clapping therapy. Clapping therapy is nothing but no. So this clapping, so this the thing we are doing from our childhood, but nowadays it's been when days post, this noise is coming reduced. So no, this clapping therapy is nothing but why we are giving clapping as a therapy. So this clapping therapy, as I have told you, hand in the place of hand and foot reflexology, we have all the acupuncture pressure points here. By giving stimulation to this, all our internal organs get stimulated. Point number one. Second point is we are giving force clap with both the hands, both the palms, all the blood circulation, as it was the terminal end, all the blood circulation, all the nerve circulation gets stimulated, and you will feel very fresh. And this helps to reduce your stress and reduce your BP. So this is the major part, and this plays a major, clapping therapy plays major part in this. And the second thing is people with incoordination, people kids, artistic kid, ADHD kid, there it helps more because that keeps the particular kid very happy and for coordination. Okay, so we'll go with the next one, physiotherapy and electrotherapy. So physiotherapy is something like with exercises, moving the hands, doing a main part where physiotherapy and electrical therapy we use is like musculoskeletal disorders. So wherever we have muscle injury, wherever we know post surgery, they can't even walk in those cases, post stroke effect. So the main form of physiotherapy is exercises. We'll go with all resisted and assisted exercises to correct those things. Okay. So massaging, physiotherapy based of massaging, and all the electrical treatments like ultrasound. Ultrasound is not ultrasound imaging of what we do during pregnancy. Ultrasound waves. For pain, we will do ultrasound, TENS, IFT, electrical nerve stimulation, muscle stimulation. So these are, we can go with next slide. I think all are done. So next, all other slides are little bit small topics. You can go with next slide. So electrical therapy, electrotherapy is like we'll use some instruments to reduce the pain, like the same ultrasound, muscle stimulator, TENS, nerve stimulator. So these instruments mainly we'll use for, as I have told you, musculoskeletal disorders. One thing is for pain reduction, and second is for main uses of after post surgery effect, post stroke effect. We want to we want to mobilize that. We want to increase the muscle tone. We want to increase the muscle strength. In those cases, we'll do this muscle manual manipulation, electrical nerve stimulation. These things are the basic thing of physiotherapy and electrotherapy. We can go to the next slide, I think. Any doubts until this? Any doubts? And physiotherapy also includes some functional tests. So in case of as I have told you before, cerebral ataxia or incoordination people, they'll do some assessments and they'll ask them to do some brain exercises. These things. So these are the functional tests to analyze the brain function. So these things also include under physiotherapy. Okay. Can I teach you some brain exercises now? Can I teach you some brain exercises? Yes or no? Yes. I got 1, 2, 3, 4, 5. Yes. Okay. 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 Sorry. One thing, you have to raise your thumbs up and your index finger. You have to point your thumb. Okay. You can just go with a dry. Alternative side. Okay. This is one. And second is, this is very common. Everyone we know. This you have to rotate. This you have to shake. Both the hands. This is 2. And the third one is, you can join all the fingers together. All fingers. Can I see? If you want, you can all turn on your camera. If you're comfortable, if you're okay to turn on, you can turn on your cameras. You can join all the fingers together and you have to rotate the fingers. Start from your thumb. Start rotating. Everything should be joined together, but you have to rotate your thumb alone, clockwise, anti-clockwise. And you can go with index clockwise, anti-clockwise. Middle finger clockwise, anti-clockwise. And ring and little finger. Okay. So these three. Next, this is very easy. This we can go with that. This one. So these are the very simple brain exercises, and these are some of the functional tests for your brain. Okay. Okay. So next we'll go with the next slide. I think It's done with physiotherapy and electrotherapy. If you have any other doubts till this, have any doubt? If you have any doubt, any clarification, we are going to finish. That's it. We are towards the end. Okay. So music therapy and Garbha Samskar. So this was the favorite one of me. Music therapy is like, no, it's like it differs from patient to patient. So if suppose we people, common layman or common people, I personally, I love somewhat like rap or fast songs, and one of my friend, my close friend, she may she may fond or she love only melody music. So those, the people based on their music taste and based on the music here, their mood and the activity and the behavior changes. So for example, so I was the person, I was not a perfect student when I was doing my medical schools or when I was doing in my college time. I never study all my syllabus on that day. I was the one who study at the last minute. If the timetable got released on that 1 month, will be like, I never search for food, I never search for sleep. I'll study only on that particular month, without sleep, without food, everything. My full focus will be on that book, but all other 335 days, I never touch book. Same in case of record. So if the external was coming next day, I'll write the record on that day before. So if I started hearing a fast beat sound, my handwriting will be very fast and I'll be writing the record very fast. If the next song was little melody, and the wordings will be very slow, and the speed of my writing will be very slow. This is the best example that music can relate our mood swings. Music can relate our behavior. Okay. So as same music, you can go in as a, you can use as a tool for the therapy. Main part where music play a major role is in case of dealing with mental related cases, means like mental health issues. So that part, music therapy will plays a major role. And the second thing, you can go with the next slide. And the second part where music play a major role is Garbha Samskar, means the people with pregnant mother. Can go with the next slide. Yes, pregnant mother. There is a particular mantra chanting, or there is a particularized programmed music that is very beneficial, or that will be very useful for the pregnant ladies during their pregnancy, in order to reduce their pain during labor, in order to increase the fetal growth inside the womb, in order to develop the neural tube development of the baby. Okay, so these are the two aspects where we use music therapy as a one of the most important tool. Okay, so you can go with the next slide. This is all about music therapy and Garbha Samskar. Even musical therapy is like, it can decide the, if it's like, if a particular person is fond of one variety of music, it can decide the personality and behavior of that particular person. So I don't know if you people have seen that movie or not. In one of the Tamil movie, the heroine will say that even the ringtone of a person will tell the character. Means like the favorite music will tell the person who, yeah. Okay, so these are the effects of the music. You can just go through. These are the effect. These are the place where music plays a role. Okay, so yes, we'll go with the next slide. Can I have the next slide? Yeah. So the next part is, we are almost at the end. Laughing therapy. So laughing therapy is like same, where we use music, where we use music therapy, at the point. Laughing therapy will also helps. Laughing therapy is like, you might have seen in gardens, people with the older grandmas, older grandpas, they'll be standing in round and they'll be laughing with weird laughings. So this laughing therapy will helps main role in all psychosomatic disorders and all psychological disorders. So this laughing therapy is nothing but we need to make them laugh. So it may be either playing music or making them fun or whatever maybe. These things are like laughing therapy. As a doctor or as a medical profession, it will be based on the therapy. As an individual, as a living human being, if we want to be make ourselves mentally happy, laughing, smiling helps. And that is helping me always. So benefit of laughing therapy is obviously it reduces cortisol. Once the cortisol is reduced, blood pressure, constructions, everything gets relaxes. So every almost like 50% of the problems will be coming down. So only there we use laughing therapy. So we are at the last Kelio and color therapy. Last slide. Cleared. If you have any doubts, you can raise your hands. If anyone have any doubts, you can raise your hands or you can put any chat in your chat box. Is that boring? Is that boring? It means heart means no. Okay.
Not
Okay.
boring.
Okay. Thank you. Said. No, ma'am. Okay, said. We'll go with the last topic, heliotherapy and color therapy. Heliotherapy is nothing but sun bath. Okay, sun related therapy. So the same, nothing but sun bath. So sun bath is main thing is for skin related disease and for vitamin D synthesis. Okay, so this is the part where people are lacking here, and this is a part where we are forced to give this treatment in every wherever we visit naturopathy clinic, wherever we visit for naturopathy hospital, this will be the first treatment. When they start, this treatment starts. Okay, so heliotherapy, there are 4 types of sun bath. First, let me tell you what is sun bath. Sun bath is nothing but exposing our body directly to the sun. Okay, so that is heliotherapy. So if the sun, if we are getting directly the sun rays to our skin, it helps in vitamin D synthesis, as you all know that mechanism, how it works. Okay, so here heliotherapy, there are 4 types of sun bath. Nothing but main thing, I just want to ask you one question. I told you sun bath that helps in vitamin D synthesis, and which time will it be better to take sun bath? Which time is best time to take sun bath?
Early morning.
Early morning? Yes. Can I have some other answers? Any other answer? Early morning? 10 o'clock? Early morning? Okay. Any other answer?
Early morning times, ma'am.
Early morning. Okay. Okay, I got answer and I'll tell you. Actually, early morning, comparing to early morning sun, 10 to 11 o'clock. This is the best time for taking sun bath. Actually, you people will have common thought that early morning will be best, but that is not. 10 to 11, 10 a.m. to 11 a.m. is the best time for taking sun bath. Okay, so that is the time where we get proper absorption and where we know where our body gets proper absorption of vitamin D. Okay, so there are 4 types of sun bath: ordinary sun bath, Pune sun bath, reckless sun bath, and bed bath sun bath. So ordinary sun bath is nothing but with minimal cloths. We have to directly stand in front of sun. The duration is around 15 to 20 minutes, but before sun bath, the main thing is like they have to drink enough water, at least 2 to 3 glasses of water. This is ordinary sun bath. In case of Kune sun bath, Louis Kune, the one who one who framed this sun bath method. So it is Kune sun bath, means like first day they have to expose their leg, and second day they have to expose little upper, one by one they have to start exposing to the sun. Reckless sun bath is like one day half, a lower half body, Next day upper half body, and third day head, and fourth day full body they have to expose to sun. And the fourth type, wet bath and wet cloth sun bath is we have to wrap our body with the wet cloth and we have to lie on the sun to take sun bath. So these are the types of sun bath, and I have told you what are the benefits. And before sun bath they have to take they have to drink at least 2 to 3 glasses of water. So the main thing where we suggest sun bath is for psoriatic patients. For psoriatic patients, they can apply neem oil and they can take sun bath. And second is for weight reduction. And third, if they want to know arthritic cases, osteoarthritis, they can have sun bath by applying castor oil or sesame oil to enhance their lubrication. Okay, so the last topic, you can go over the next slide. The last topic is color therapy. It's done. Sun bath is done. Types of sun bath is done. Yes, color therapy. So color therapy is also called as chromotherapy. So this chromotherapy is in naturopathy side, they are using in very minimal hospital. Chromotherapy have been practicing nowadays. This is like completely based on colors. Okay, so like their atmosphere, this will be helpful in case of giving counseling. So how to frame a room, how they have to frame their hospitals, or how they have to frame their bedrooms. So that the most harmful color is like green, white, blue. But in case of these three are calming colors. So preferably these three you can go for your rooms or house. But blue is for like something calm, something like sedative. For sleeping disorders, you can go with blue. The most interesting part is this color therapy. They'll give us a color charged water to drink to treat the disease. On my personal experience, I haven't given this color therapy to any patient, and I haven't seen any patient getting cured. But I have heard that in some parts, some hospitals, some clinics, they are giving color charged water to treat the disease. So red color is have a property of increasing the blood circulation. So something like aggressive, something like hard. So based on the color property, it have therapeutical effect also. And even oh my god, am I audible?
Yes, ma'am.
Okay. So
Yes, audible, madam.
based on the colors, even the character of a person can be decided based on their favorite colors. Okay. Okay, we are done with all our topics. If you have any doubts, you can just pin your doubts in the chat box. Just 2 minutes. And before your doubts, is the class was useful? If it was yes, you can start typing yes. Around 120 to 130 people are here. I need all of your response. If it was no, you can just go with no. Please share PPT. Sure, I'll share. It was good. Yes. Okay. Sure, I'll share I'll ask the team to share the PPT to you. Okay. So is there any doubts? If you have any doubt, you can just pin your doubt now. And those who are done, if you don't have any other doubts, you can just leave the team. And thank you so much. And thank you so much for our ex-doctor for joining me on this. And thank you so much.
I would like to extend our heartfelt gratitude for your inspiring and informative guest lecture on hydrotherapy, acupuncture, and many more. Your expertise and engaging presentation provided valuable insights into these holistic approaches to health and wellness. Your passion for these therapies was evident and impactful. Thank you once again, ma'am. Thank you, ma'am.
Thank you.
Last but not the least, I would like to thank all the participants for your enthusiasm throughout the session. Kindly fill the feedback form which is available in the chat box. Have a good day. Thank you.